My client is a 48-year-old male who lives in West Michigan with his wife. He is suffering from multiple fractures and burns throughout his entire body. He may have a possible head injury also. So, in regard to all of the issues that he is suffering from, his client factors are all affected. The ones that stand out to me that are affected are the functioning body parts and then just the structures of them. So obviously the body functions are different because given his current condition, he is pretty much bedridden. So if his body is telling him that he needs to go to the bathroom, he's unable to actually get up and go to the bathroom. And then obviously his structures are affected because he has multiple fractures. So in regard to the fractures and the burns, you sometimes can't do surgery because of the burns that are covered. So, given the information that he has multiple fractures, meaning he has many broken bones, you are aware that the structure is different. Obviously, time will heal the bones, most likely, or with some sort of surgery to repair the bone, they will heal, but at the given time, the structures are different. They can't weight bear, they can't lift objects. So ultimately they are affected. Along with the client factors that are affected, his performance patterns are obviously going to be changed also. So the routines of his life obviously changed a crazy amount because he was once he got up, went to work, did his occupations, lived his normal life. But now his routines are dependent on the hospital and when the staff can come in, change his bandage, get him to sit at your bed, and do of all that sort. So along with his routines, his roles have changed immensely too. He is a father, he's a friend, and he's a husband. So those are his normal everyday roles. But right now, his role is just to be a patient and to recover from all of his injuries, focusing on the client-centered approach. His short-term goal is just to recover. So a lot of times with burns, one of the main focus is edema management. To do this, you want to position them correctly in bed. So that is one of the interventions that I'm going to show you today. And then also in regard to his long-term goal, that is just to get back to his occupation, which is snowmobiling. This is kind of difficult to do right now, so the main step that we want to focus on is just getting him to sit edge of bed. He is non-weight bearing on all aspects of his body except for his left elbow. So this is pretty difficult. So in order to do this, the workers can't necessarily do it on their own. They are going to need an aid to try to help him get up and sit edge of bed with his feet dangling on the side because, like I mentioned, he is non-weight bearing. This is also important because of the bed sores. When people are in the hospital for a lengthy amount of time, they are prone to get bed sores, and we really want to ensure the safety of our client. So just getting him to sit edge of bed, positioning everything to not create a bed sore is very helpful. So this intervention that I'm going to be doing right now is in regard to his short-term goal, which is the recovery of his injuries. So we are going to focus on edema management with bed positioning. As you can see right now, my client is laying on the bed with his head above his heart. So now I'm going to go through and put pillows on under his arms and under his legs just to keep that circulation of blood going. So I'm going to use the pillows, if you can see, and place them under his arms. And while I'm doing this, I also want to focus on if the client is comfortable because that is also always a concern of ours. So I'm going to have you. Are you comfy?
I am.
So that is the first treatment portion that we are focusing on today. Okay, so now for the second intervention, focusing on his long-term goal, which is getting back to his occupation, which is snowmobiling. Since we can't necessarily go out and go snowmobiling today, given his current medical state, we are going to practice sitting edge of bed. This is important for bed sores, like I mentioned earlier in the video. So that's one of the reasonings as to why we are going to be doing this today. An important factor that we want to look upon is the fact that he is non-weight bearing. And I previously mentioned how it will take multiple team members to get an individual to sit up with only his left elbow being weight bearing. But today I'm going to do it by myself and just pretend that somebody is next to me helping me. So I'm going to start by removing the pillows just so we have more room. So now that the pillows are out of the way, I would have my team member on the other side of the bed. Obviously, it wouldn't be as large as his, so we could reach across. To do this, we would pretty much do all the work for him because he is non-weight bearing. So we will take his legs, carefully focusing on where the burns are and the possible skin grafting is. So, and then obviously team members will still help to lift him up, non-weight bearing, but I will encourage him to push off of his left elbow because might as well use that weight bearing status if we have it. So I'm going to have you push off this elbow and help you sit up. Good job. Get out of the way. So obviously here, I would put the gait belt on and just have him sit up for a lengthy period of time just to make sure that his skin is getting off of the bed to ensure no bed sores and just, you know, give him that sense of relief. So then we would lay him back down. So overall, both of the interventions that we displayed today are in regard to his short-term and long-term goals. This is client-centered approach, and we are focusing on what he wants and what will help him reach his goals that he has. The first step is obviously recovering from his injuries that will take a good amount of time given everything that he is suffering from. But then his long-term goal, it is accomplishable if we, finish his short-term goals. So now that we have covered two intervention plans regarding his short-term and long-term goals, there are also assessments that can be done. One that I included in my paper is regarding a direct wound culture. So this kind of just ensures that there isn't any infection going on in any of the wounds. This test or assessment can really help in the planning of future interventions because if there is an infection, it needs to be treated. If not, you know that you are doing things properly. So lastly, I would like to mention the fact that my client is currently in the hospital. When we are working on all of these goals and he has completed them, he will be most likely transferred to some sort of rehab, inpatient or outpatient, given the fact that, like I said, he is in the hospital, just for further rehab. Especially with burns, there are a lot of additional things that you can do at home or in an outpatient setting. So that is something that he will most likely be taking part in.